Hi, cherished listeners and viewers. Welcome to another episode of Licensure Hub. Today, we are going to continue with our general paper discussion. Last week on our general paper episode, we talked about obstetrics. Today, we are going to look at psychiatry nursing and some of the multiple choice questions that we are likely to meet and how to go about them. Before that, I'll urge you all to continue to share the link and subscribe to your YouTube channel, Licensure Hub, so that as and when we release our video, you'll be notified and never to miss a single bite of our episode. To begin with, question 1. Miss Sam Benson, a 19-year-old man, was admitted to the assessment unit of the psychiatric hospital with a history of bizarre childish thinking, disordered motor actions, and speech disorders. The best diagnosis Mr. Benson will be schizophrenia. A. Catatonic. B. Paranoid. C. Hebephrenic. What then is schizophrenia, one may ask? Schizophrenia, as coined by Eugene Blair, means a split of mind. That's what schizophrenia basically means, a split mind. And so we have types of schizophrenia. And by research, schizophrenia is by far one of the most common causes of all mental illness we face in today's world. Types of schizophrenia mentioned in this question, we have catatonic schizophrenia. When we talk about catatonic schizophrenia, it is a type of schizophrenia marked by defect in motor activities. You can have stupor as one of the symptoms. You can have excitement as one of the symptoms of catatonic schizophrenia. So it is marked by psychomotor disorders. That's what catatonic or catatonia schizophrenia means. Option B said paranoid schizophrenia. One of the distinctive signs of paranoid schizophrenia is that they don't trust anyone. And they always have the notion that somebody wants to harm them. And so per this explanation, does that make our answer relevant, or is that part of the symptoms given the question? Obviously, no. Hebephrenic schizophrenia. Yes, hebephrenics are the perfect example of what has been explained in the question. They have bizarre thoughts and they have motor problems as well. And so per the definition of the symptoms given in our option, we have no choice than to fall on what? Hebephrenic schizophrenia as a correct answer. Which of the following can be a complication of severe mania? A. Exhaustion and malnutrition. B. Increase in appetite and weight gain. And C. Malnutrition and poor personal hygiene. The question seeks to seek our understanding on mania, severe mania to be precise. What then is mania in psychiatry? Mania is a state in which a patient becomes euphoric or overexcitement, characterized by aggression and pacing up and down. That is what mania simply means. We have conditions that we call bipolar disorder, which has two episodes, that is the depression episode and the manic episode. And so when we say a patient is in severe mania or is in the manic episode, it means it's characterized by overexcitement, the patient pacing up and down, aggressive. That is what mania simply means. Now, what will be one of the complications of severe mania is all what they are asking us in this question. One of the best, or looking at the possible answers, exhaustion and malnutrition is what mostly comes out as a complication of a manic patient, because pacing up and down will lead you to be exhausted. And as a patient is pacing up and down in the manic episode, you realize that he or she might not have time to even feed. And that is why we were taught that you have to continue remind the patient and give the patient attractive snacks so that he or she can build up his or her energy level. And so our correct answer here as a complication of severe mania will be exhaustion and malnutrition. Madam Anna Samaba is more preoccupied with orderliness, perfection, and interpersonal control. She hardly considered being flexible, open, or efficient. Madam Samaba's condition is a clear case of A. Obsessive compulsive personality disorder. B. Narcissistic personality disorder. C. Antisocial personality disorder. Now, one may ask, what then is personality disorder? Because the question is seeking to give us a characteristic of a particular group of personality disorders that we have. Personality disorder can be termed as a kind of disorder that faces most people worldwide. And based on the symptom that you present, your specific class is given. Now, A is saying that obsessive compulsive personality disorder. What is that disorder? Or what class of disorders are those people? Those people are classified as what? Perfectionists. They do things in an orderly manner. Those are some of the symptoms of obsessive compulsive personality disorders. Option B we have is a narcissistic personality disorder. What type of symptom does these people exist? These people have self-inflamed ego. They feel so important than others, and they always want to catch that attention. These are the people who we classify, or anybody behaving in such manner, we say they are narcissistic or they have narcissistic personality disorder. Antisocial personality disorder, option C. Antisocial, this should tell you that these people, they have general disregard for law or for rules and regulations in the society. They have this kind of stubborn behaviors. They don't respect anything. They most often break rules and regulations in society. These are the people we term as antisocial personality disorders. And so based on all that I've explained, looking at the parameters given in the question, you realize that these are symptoms and characteristics peculiar and pertaining to what? Obsessive compulsive personality disorders. Hence, our appropriate answer will be our option A. Mr. Danso recalls what happened years ago, but not able to remember recent events. He is said to be suffering from A. Retrograde amnesia, B. Anterograde amnesia, and C. Disorientation. This question seeks to examine candidate on memory, specifically amnesia. In psychiatry, amnesia is basically defined as loss of memory or memory impairment. Option A is looking at retrograde amnesia. Retrograde. That tells us that the person is not able to recall event that has occurred in the past. For example, 2 years ago, he had a very fatal illness or a very contagious illness, which he or she cannot recall. So, if you are not able to recall past events or past occurrences in one's life, that is retrograde amnesia. Anterograde amnesia is a type of amnesia that occurs when one is not able to recall recent events or to learn recent events. You are not able to recall event that has just occurred. For instance, we just finished giving you an information to do this, and about 5 minutes or 10 minutes later, you are asked to give back the same information. You are not able to give that. That is what anterograde amnesia. You are not able to recall recent events or occurrences. Disorientation, as the English name suggests, one is not well oriented to use your environment. It could be time, it could be place or persons. Back to the question, you realize that they are seeking our knowledge that the person is not able to recall recent occurrences. And this should quickly ring a bell that is what? Anterograde amnesia. And so our correct option here is anterograde amnesia. Thank you for listening to this interesting episode of our today's Licensure Hub on psychiatry nursing. I'll urge all of you to continue to subscribe to the link so that as and when we release a new video, you'll be notified. See you same time next week on Licensure Hub. Thank you.